Major concern through the pandemic, mental health, specifically suicide rates. There was a lot of worry that lockdowns may trigger an increase, but we're learning some positive news. Jacob Rich is a health and drug policy researcher at the Reason Foundation. He's up late with me live here on the Final Five. Jacob, good to see you tonight.
It's great to be back, Jim. Thanks for having me.
Interesting numbers here, and let's talk about it. We have seen, I know there were a lot of concerns about it, and understandably so. Lockdowns, all of these restrictions in place, people not able to live their lives like they normally do, but the number of suicides has actually gone down.
It most certainly has. According to CDC data that was given early to the Journal of the American Medical Association, suicides dropped about 5.6% in 2020 compared to 2019. Now, this comes as a big surprise because the Substance Abuse and Mental Health Services Administration, one of the HHS jurisdiction administration offices, they actually published data saying that thoughts of suicide, suicidal thoughts reported in surveys went up. But amid all of these data, we saw that the actual rate went down. And when you look at the research, historically, reports of suicide at the macro level, at the national level and the state level, not the individual level, but at the state level and macro levels, they don't usually predict suicide rates. So for the data not to match, that's not completely surprising. But amid all the mental health troubles during the pandemic, it's certainly a surprise and something great to be seeing at the moment.
There was a lot of talk about the concerns out there that I noticed, not just from medical experts, and to be honest, there were a lot of companies that were really advocating the idea of mental health services, whether it be by texting, whether it be by video conferencing. I noticed a big push to make it more accessible. Was that one of the factors, or what are some of the other factors that you believe maybe have contributed to that drop?
It's going to be hard to determine because right now we only have preliminary data. The detailed data, the individual data, will not be published until 2021 December. So we have a lot of months before we actually can parse out the data and try to figure out the specific causes.
I'm the same way. It's been a long day.
Yep. But in my opinion, and honestly, through the research that I've done and through the literature, the number one factor for suicide rates at the state level is certainly isolation. And we actually saw 15.9 million people move during COVID, which is pretty close to an unprecedented number. And these people didn't move into the city. They actually moved out of the city. And they actually repopulated the lower density areas, people moving from New York to Connecticut, people moving from New York to Tennessee, Washington, D.C. back to Ohio. So the repopulation of rural areas, in my opinion, is actually why suicide rates dropped.
And I also think what's interesting is one other factor that came up in our last minute here was that some of these government programs, I know we're not always looking for more government, but the idea of expanding some of these unemployment programs may have actually helped.
Yeah, there actually is some truth to that because the second most important factor when we look at suicide rates. Number one is isolation, population density. Wyoming, Alaska by far have the highest suicide rates, probably because of seclusion and people being lonely. But number two is unemployment. And during the Great Recession, we actually saw massive increases in suicide as unemployment went up. And under the Trump administration, unemployment duration, the duration of benefits increased and the amount of payments increased. So giving people more of a cloud to land on as they became unemployed during COVID might have also contributed. But again, we have to look at the data to make sure.
Yeah, I think when you look at programs like that, I mean, I know sometimes it's easy to say that people just have a handout, but I think sometimes there are reasons that you do this, and there are reasons that you offer help. And just as on a personal note here, as I leave here, Jacob, I just want people to know, the last year was tough on me too, and I'm sure a lot of people out there as well. And I'm sure you would agree with me that if you need to find help, there is lots of help out there, and you will be better for it. Jacob, here's to a happier, healthier 2021 for all of us. Thank you for joining me tonight. I appreciate it.
Thanks for having me, Jim. It's lovely to be here.
It's good to see you again. And by the way, the beard looks great.
Oh, thank you. You should see the hair. It's getting pretty long.